Hi, I'm Dr. Anna Saylor. On top of my chiropractic degree, I've actually taken an additional 3-year study in pediatrics and in pregnant women. There's only about 300 chiropractors in the world that have this degree. During pregnancy, your body actually will change, and it's supposed to change. So we see a lot of different structural, postural changes. We actually provide special care for our pregnant moms, and things are going to be very different with your body. Your gait is going to be different.
The biggest difference between my first pregnancy and my second was that I had a solution for the discomfort that is daily, especially late in your pregnancy. I had someplace I could go where I felt like I'm going to go there and it's going to make it better. Even if it doesn't make it go away, it's going to make it much better. And I just continually came and I wasn't struggling nearly as bad. But the biggest difference, honestly, with the care was my birth with my second baby. Because with my first birth, it was, a typical long birth, which the first ones usually are. It was like a 15-hour birth, or labor, I should say. And she got stuck in my pelvis for like 3 hours in the middle, and there was a lot of things I needed to do to fix that during that process. I came here, like I said, with my second pregnancy, all through my last trimester, and my birth literally was, I was in active labor at 3:30 in the afternoon, and she was born at 7:15.
A lot of the traditional pain, like sciatic pain, that women experience when they're pregnant actually can be taken care of very, very easily with chiropractic care. If your pelvis is misaligned, it may mean that there's less room for your baby to grow. A pelvic misalignment can cause a harder delivery, but it also can cause a number of other problems, like a breech baby.
Since I've been being adjusted while I've been pregnant, it's helped with my low back pain, pelvic pain, leg fatigue, leg cramping, just overall having more energy and mobility. I've still been able to exercise moderately. I was able to work up until 32 weeks, which is kind of unheard of with twins. So I've been able to do quite well throughout my whole pregnancy, and I think KST and chiropractic has really helped with all of those.
With chiropractic care, we can make a big difference in nausea, heartburn. We can even make a difference in the position the baby's in. When you're pregnant, you have a lot of hormonal changes, and an adjustment will make a big difference in how you feel. Women that have regular chiropractic care through their pregnancy actually have shorter and less painful deliveries. Studies actually show that it takes about 3 hours off the average delivery time. The very first trauma can actually be childbirth, and we'll come to the hospital and adjust your baby as soon as it's born.
Sloan and Will are twins. They were born on December 2nd of last year, and they have been getting adjustments from Dr. Saylor since they were about 2 weeks old. They come about every month.
We actually have a room for children. It's called the Jungle Room. It makes the adjustments fun. Kids actually don't even want to leave the office. Think about the milestones that babies actually go through in that first year of life. When they start to learn how to crawl, they start to learn how to walk. How many times have they fallen when they walk? And we can make a big difference in their overall health.
With my kids, they'll have something adjusted, and I will usually within a day see some sort of a change. Not necessarily something completely going away, but something has changed. The body is doing something differently.
I can tell with the kids too, if they start to feel a little congested in their nose in the mornings, if they're just kind of ornery or they're not sleeping or eating, I know that they need to be adjusted, and that always does the trick.
Using KST, because we can adjust a lot of cranial bones very, very gently and very easily, we find that we actually make a big difference in ear infections, asthma, allergies, ADHD, especially even their emotions. I know for a fact my own children, they get adjusted when they get a little bit crabby. That's the time we know to adjust them, because we're affecting the brain and the nervous system.
He started sleeping through the night again. Every time I would skip a week, they would come back because he had chronic ear infections, and so we would come, and the difference in him, his behaviors, everything was great. I mean, just even walking in, he would be screaming and sitting in the lobby, and I don't think I can wait. And he'd get in the room with Dr. Saylor, and he would just go peaceful, like he was in a trance almost, as she adjusted him.
If your child is experiencing a very specific condition or health issue, please let us know. Give your child the best start with chiropractic.